Pennsylvania is facing a heroin epidemic. The deadly drug and its gateway, prescription painkillers, could be on pace to kill more this year than homicide. Today on Pennsylvania Newsmakers, the new way the state is fighting back with prevention, recovery, and a small savior. Plus, new calls to change state law now that priests in the Catholic Altoona-Johnstown diocese have been exposed with sexually abusing children. Pennsylvania Newsmakers starts now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host.
Thanks for joining us on Pennsylvania Newsmakers. I'm Pete Muntean with WGAL TV. Terry Madonna has the week off. This week, we're zeroing in on Pennsylvania's heroin crisis. It is an epidemic that has permeated the state. We have many minds here who are zeroing in on that. We're starting with Secretary Gary Tennis, the first ever Secretary of the state's Department of Drug and Alcohol Prevention. Dr. Karen Murphy is here. She is the Secretary of Health. And Dr. Scott Shapiro is the President of the Pennsylvania Medical Society. Thank you all for joining us today. Can you guys tell me first, starting off with how hard this problem is, how large this problem is? It's a hard one for you guys to really pinpoint.
This is actually the worst epidemic of any sort in almost 100 years since the Great Flu Epidemic of 1918. We know that in 2014 we lost about 2,500 Pennsylvanians. That's about 7 a day to this crisis. Based on the information coming in from coroners around the state, we know the 2015 number of deaths are going to be even greater, and in January and February of 2016, the pace is still going up. So the problem continues to get worse. The number of deaths are staggering. We are going to lose in the United States more people this year to overdose than we lost Americans to the entire 12 years of the Vietnam War, all telescoped into 1 year. And these aren't just numbers. Each one of these people is a family member. They have loved ones who have struggled with this issue, trying to get help for their loved one, and then finally watching them die. So these are 25, in Pennsylvania, it's 2,500 shattered families, not just statistics.
Dr. Murphy, this is something the Wolf administration is taking seriously.
The Wolf administration began its work on prescription drug abuse and heroin addiction the first week of the administration, and we have a multi-agency approach to this horrific epidemic, as Secretary Tennis said. I'm a registered nurse and I've been in healthcare for decades, and I have never witnessed anything that is as far-reaching and as devastating as this problem.
Can you give me the perspective of doctors out there in the field? How big is this for them? This is something that you're coming into contact with almost daily, and also prescription drug abuse too.
Yeah, these aren't just statistics. These are real people, and we're seeing it all the time in the hospitals. My most recent case was just this past Saturday of a very unfortunate young man whose mother found him at home. Fortunately, her CPR saved his life, but many won't be as frequent, who had overdosed on heroin. We are seeing it in numbers that just a few years ago we were not seeing, and it's scary how many lives it touches. It really spans all socioeconomic classes, all education levels. There really is no community that isn't touched by this problem at this point in Pennsylvania.
Secretary Tennis, how do we get started on this? Where do we start first, do you think? Is it more prescription drug abuse, which is largely seen as the gateway, or do we need to sort of do a back-end recovery and prevention more than anything?
We actually need to be moving on all fronts at once. It's a little bit like when we were at World War II, and you wouldn't say, do we need the Army, the Navy, or the Air Force, or the Marines? We need all of it. We know that today 4 out of 5 people addicted to heroin are getting started on prescription opioids. So we need to be working on prescribing guidelines, which Dr. Rachel Levine and I are working on with the Medical Society and other medical groups, the prescription monitoring program, teaching our citizens the critical importance of getting those medicines out of the medicine cabinet and into drop boxes, which I hope we get a chance to talk about, because many of our kids are getting started by stealing prescription medicines from drop boxes. So we need to work at that level, but we're also, as a society in the United States, we're vulnerable to these rolling epidemics. I've seen several of them in my lifetime: the first heroin, the cocaine, crack, methamphetamine. The federal government says we fund treatment at the level of 10% of what's needed to take care, enough treatment for one person for every 10 people with addiction. So we will continue to be in our lifetimes vulnerable to these rolling epidemics as long as we don't really fully resource this problem. Congress has cut the funding to the Drug and Alcohol Block Grant 25% over the last 10 years in real inflation-adjusted dollars as we've descended into this overdose crisis. We need to make sure when we're choosing who we're going to elect to Congress, to the Senate or the House, that they're committed to fully resourcing this problem, because they have not been so far.
I'll open this one to all three of you. Why is this such a problem in Pennsylvania? Maybe that's a tough question, but maybe a tough thing to pinpoint. Dr. Murphy, what do you think?
It's a problem not only in Pennsylvania, it's a national problem. We are seeing some statistics that the problem may be worse in Pennsylvania. In terms of the start of the problem, we've pinpointed definitely to be prescription drug abuse. So as Secretary Tennis said, we have kids that are taking families' prescriptions. I think the attitude towards prescription drugs maybe gives young people a sense that it couldn't be quite as bad. But I was at a conference recently and heard the speaker say when you write a prescription for an opioid, you are writing a prescription essentially the same magnitude as heroin. And
talking about writing prescriptions, I mean, what do doctors think about that?
I think it's an important fact to keep in mind. I don't think that I think that when prescribed properly, that there is a very strong role for opiates, and there are many patients. I would say probably the majority of patients who are on opiates who are not diverting them inappropriately and who are taking them in the appropriate way. But there is a large enough number that it has everyone's attention in a very scary way of patients that are getting opiates inappropriately, taking them inappropriately, and I think that it's very important for us to know not only who is taking the opiates, but how they are handling those medications to make sure that those who should be taking them have full availability to them to treat their appropriate problems, and those who should not, we should be able to have ways that we can prevent that from happening.
In the next segment, we'll talk more about the state's prescription drug monitoring program on Pennsylvania Newsmakers continues.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to Pennsylvania Newsmakers. I'm Pete Muntean. Terry Madonna has the week off. We're talking about Pennsylvania's heroin crisis and how to stop the problem before it even starts. Dr. Karen Murphy is the Secretary of the state's Health Department. Can you tell me more about the state's prescription drug monitoring program? You guys are getting ready to roll that out, but it's not set yet.
Yes, Pete. So we have secured the software and for the prescription drug monitoring program that we think will begin in August. And the Department of Health is very excited about the potential for prescription drug monitoring program, really to help physicians help their patients. And that's what we're looking at this tool is going to be able to do. So doctors will be able to look in their offices at prescription drug history to determine if there's potential abuse. And then what we'd like to do is if there is potential abuse, get that patient right into treatment. So we will be working, we've had tremendous support from the Pennsylvania Medical Society, and many of the medical centers all over the Commonwealth will be working with individual doctors and dispensers and educating providers and dispensers on the importance of getting people to treatment.
Your members are integral to this. How are you helping, and what will it mean when Pennsylvania finally has an implemented prescription drug monitoring program?
I think it's critical. The Pennsylvania Medical Society over 5 years ago started to identify this problem and started with educational activities for physicians that continue today. And those activities are very important and are valued by physicians, but they only get us so far. We really don't know when we are seeing a patient at the bedside if they have a legitimate need for an additional prescription for narcotics and should get it, or whether or not they were seeing another care provider, another physician just yesterday and got a prescription. This database will allow us to see the history of what someone has taken, what prescriptions they filled, and make sure that those who need the medications appropriately get them, and those that should not be taking them don't get them, so we can decrease those number of pills that are being diverted for inappropriate use.
Secretary Tennis, we were talking in the break about a prescription drug take-back program and how people came out in droves and almost overwhelmed this program, you said. It sort of speaks to the prescription drug problem and how pervasive it is in Pennsylvania.
Well, we've worked, and the Pennsylvania Commission on Crime and Delinquency actually helped us fund a drug take-back program where we place these drug take-back boxes. They look like a mailbox in police stations, following DEA regulations. The DEA originally was taking those drugs away and destroying them, but they said we kind of overwhelmed their program, I think, both here and I think in other states as well. The National Guard in February 2015, early on in the Wolf administration, started doing these, removing the contents of the boxes and taking them to incinerators. In about 10 months, they collected over 40,000 pounds of prescription drugs. So one of the things I hope your listeners understand is how critical it is today to get unused prescription drugs out of the medicine cabinet and to one of those take-back boxes. If you go to our website, just Google Department of Drug and Alcohol Programs, very prominently there's a link. You can put in your zip code and it will tell you where the nearest drop box is. If you leave them in your medicine cabinet, they are vulnerable to be taken, particularly by our young people who we care about the most and don't want to see get into trouble. You
say now is the time, spring is the time. Do your spring cleaning and clean out your medicine cabinets now, right?
I think it's a great point, and I think the other point to make along with it is throwing them into the trash or flushing them down the toilet really can create additional problems. So making sure you dispose of them timely and in the right way is really very important.
We'll talk more when we return about Pennsylvania's standing order to get naloxone, the small savior that could stop a heroin overdose in its tracks, when we come back.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Welcome back to Pennsylvania Newsmakers. We're talking about the state's heroin epidemic and the small savior called naloxone, better known by the brand name Narcan. Secretary Gary Tennis, we have seen this in action before. It looks like a small nasal spray. It's very tiny, and this has saved many in Pennsylvania, you say.
Pete, it's saved thousands, actually.
Stops a heroin overdose in its tracks.
It turns it around. Even when the heart has stopped sometimes, they're able to bring the person back. Police have started carrying this, and we have more and more municipal police departments doing that. We recently had a recognition event. We have over 650 saves now by police officers in the last year and a quarter across the state. We're working hard to make sure every police department in the Commonwealth of Pennsylvania is carrying this drug, because they are very often the first ones to be at the site, and every second counts when somebody's overdosing.
The Department of Health is trying to get this in more places. There's a standing order to try and get it to make it over the counter. Some CVS's and Walgreens are now carrying this as well, and you want to make sure that people know how to use it the right way.
We would like all pharmacies in the Commonwealth to carry naloxone, and we urge family members to have it, family members, or if someone knows someone that has a problem with addiction and is around them frequently, we're encouraging them to go to our website, take the instructions, print the instructions out, and bring them to their pharmacist, because pharmacists, we're trying to educate everyone to the importance of obtaining naloxone. And as large Commonwealth, challenging with education, so we've posted all of the information needed to get a prescription on our website.
And the URL is?
healthpa.gov.
And we'll have that on the screen for you. Pennsylvania Newsmakers, we'll be right back.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Thanks for joining us on Pennsylvania Newsmakers. I'm Pete Muntean. Dr. Madonna has the week off. We're now talking about child sexual abuse. After priests in the Altoona-Johnstown diocese were exposed for sexually abusing children over decades, now there is a renewed call to change state law. I'm here with Kristen Houser with the Pennsylvania Coalition Against Rape, one of the state's leading victims advocates, if I could spit it out. Tell me in brief, what happened in the Altoona-Johnstown diocese? Why this is such an important issue for victims advocates?
Well, what happened there is the same thing that we saw happen in the Philadelphia Archdiocese twice during the past 20 years, and what we've seen in Boston and many, many other places. That after a grand jury investigation, they found extensive records that demonstrated knowledge of 50 priests and other officials with the church were known to have sexually abused children over 50, 70 years, and hundreds of children. So there's a massive impact on the community with the fallout from that kind of traumatic experience.
The big issue now is that many cannot be tried. Some have died, but the statute of limitations has run out.
Yes. So Pennsylvania's law really does limit the amount of time that people have to seek justice either in the criminal courts or in the civil courts. And for many of these cases, that time has long expired.
Why has this not changed? Why has this sort of been stuck? There are several bills to do this. Maybe we'll start off with first by asking, what do you want? What does the Pennsylvania Coalition Against Rape want?
The Pennsylvania Coalition Against Rape would like to see a complete elimination of the criminal statute of limitations, the civil statute of limitations, and we would like to see a 2-year window to be allowed. So that would be a one-time 2-year period of time that survivors of child sexual abuse for whom the statute had expired would have a one-time chance to try to bring civil action for those past crimes.
But this has been stalled out for a while.
It's been stalled out for a very long time, yes. Stuck in committee. We know, obviously, the Catholic Conference is not supportive. In particular, the civil statutes are much more contentious than the criminal. So we are making a push right now to separate them, but to work on both. It's important to change this because of the mentality of victims. Delayed reporting is something that happens a lot. All the time, yes. Delayed. So some of the arguments used against this are that evidence is lost, memories fade, and then what do you have left to work with? And frankly, I don't know why that matters to anybody other than people that are charged with investigating it, because for some people, memories sharpen over time. We know that delayed reporting is normal. It should be expected. And frankly, that's the reason, the number one reason that Pennsylvania should change their statutes to reflect the reality of survivors. Can you tell me a little bit more about the mentality of victims? You and I got to know each other during the Sandusky trial, and that was, in many cases, delayed reporting. It took years for victims to come forward. Why is that? Well, there are a series of reasons why. Number one, shame, humiliation, and embarrassment about what's been done to you will keep somebody quiet. Number two, over 90% of the time we're talking about child cases. The perpetrator is somebody that the child knows and trusts, and that the family knows and trusts, oftentimes that the community knows and trusts. So it's a violation of trust, a violation of a perception of character in the community. So when you have an authority figure abuse that, it's an additional barrier to come forward and report. When you're talking about male children, male teens, now we've got fear of homophobia and slurs and other things being used against them. So people, for the most part, keep this very private. Additionally, some people do try to tell, and if you are met with disbelief on that first outcry, then you stop. You just want to find a way to get on with your life and not talk about it.
You've held rallies about this before. This is something that has been a problem that's been called for, a fix has been called for prior to this most recent rash of sexual abuse. And you have scores and scores of cases to sort of underscore the need for this.
Right.
This is, in many people, you and I might know.
Yes.
I mean, it's everywhere, I guess.
It is everywhere. It is everywhere.
It's not an extreme cases just like the archdiocese.
No, but I think what's important that this case highlights, some of the arguments against this change don't stand in this. Evidence hasn't changed. These are handwritten documents kept by that institution documenting what happened. That's viable evidence. In this day and age, we also communicate electronically and use technology for surveillance and all kinds of things. Our life now is much more likely to have kinds of evidence to corroborate or substantiate claims that can be kept for years and years and years. So we know that for survivors of this crime, many times they are motivated to come forward when they realize that the person who harmed them still has access to other victims, and they simply want to put an end to it.
How likely is it now that the statute of limitations will be changed after what happened in the Altoona-Johnstown diocese?
I am very optimistic that the criminal statute will be eliminated. I think we have more work to do on the civil, but what has been fantastic is that there's been a real outcry from the public. There have been opinion editorials printed in newspapers all across the Commonwealth, all in agreement that it's time to get rid of them. We
have only a little bit of time left. What will it mean for Pennsylvania if the statute of limitations laws are finally changed?
I think it will finally help us catch up. We have been the focal point of numerous sexual assault scandals now, numerous in the Archdiocese, Bill Cosby, Jerry Sandusky. All of these cases have had many, many victims who've not been able to seek justice for themselves, healing for themselves, and ultimately safety for the community. So this is in the Commonwealth's best interest to change the law.
Kristen Houser with the Pennsylvania Coalition Against Rape. And that just about does it for us here on Pennsylvania Newsmakers. Terry Madonna will be back next week. I'm Pete Muntean. Have a good week ahead.